So let's talk about this. I mean, common sense tells us that wearing a helmet is a good thing, right? Do you guys wear helmets? Sorry to put you on the spot. I wear a helmet. Somebody over here wearing helmets? Okay, good. Now, what about ATVs and those sort of things? I think we can extrapolate this data to that as well. Anybody riding ATVs, four-wheelers, three-wheelers? How about three-wheelers? We just get rid of those? And those are so unstable. That's a bad thing to use for sure. Well, we all do things for recreation that have some inherent risks associated with them. And so it's probably not fair to judge the motorcyclist to say, you know, it's too much risk with what you do, but I'm a skydiver and that's okay. You know, but we have to minimize that risk, and one way to do that is with helmets. What's amazing is we did have some great legislature out there, started in the 60s, that really mandated that all the states develop helmet legislature. Otherwise, they wouldn't get highway repair funds that they needed. They would be penalized. And that's the interesting thing about the evolution of all of this history behind helmet laws and how they got repealed. So it was Congress that said, we're going to put this in place, and we're going to make sure, because we know it's a good thing, and we're going to have everybody with helmets in the mid-1960s and move forward from there. So all the states at that point, with the exception of 2 or 3, went ahead and put their helmet laws in place. And they got them in place, and it was working great. And then what happened was one thing. They decided that there were some people who were concerned about how it was determined that states would be penalized. When you look at the Constitution and you look at some of the restrictions there, if you look at the 10th Amendment in specific, the 10th Amendment says, listen, the federal government cannot tell the states how to do their business of managing their people, how you pay people, how you run your state, as long as it doesn't interfere with the federal government. So actually, you know who repealed the federal statute? Congress repealed their own. They looked at it in the mid-70s, like 1976, and said, you know what? Despite the fact that this really works, this is unconstitutional. And now that we're looking back on it, the previous Congress erred in passing this, and it cannot be done, and the Supreme Court hadn't looked at it. Well, once that was looked at, they said, well, we really can't do this anymore, so let's get rid of it. What do you think happened to all the state statutes at that point when they got their highway repair money anyway, regardless whether they had a law in place for helmets? Anybody? Yeah, well, those helmet laws got repealed one by one very quickly within about a year or two. And so what happened at that point? Well, people got more significantly injured, and we'll talk about the data on that. And what we have now at the state level is a civil liberties issue. It's a civil liberties issue. The 14th Amendment will not allow a state to take away somebody's due process to have civil liberties. And what are those civil liberties? It's the right to liberty, it's a right to own property, it's a right to life. This is a civil liberty issue, and when a state tries to put one of these laws in place, like many states have at this point, the activists against this invoke that right. And that's where the issue has been and why many state laws have been repealed, because they claim that this is a 14th Amendment due process violation. You cannot remove my ability without very, very strong reason to really meet a strong governmental interest and remove my rights by doing so. And that's why all these get repealed, and I can guarantee you if others are challenged, there's a pretty strong precedent set that they'll be repealed based on that as well. But how come other activists really haven't been successful? What about seatbelts? Do seatbelts work well for us? Same concept. They work great. But do you see people saying, I care to swing freely in my vehicle. You know, I don't want to be restricted in my vehicle. I love driving around in my Yugo and not being able to, you know, whatever it is. So there's no group out there saying, we don't want to do this. But the motorcyclists, they are a band together, and they have said, you know what, we like to ride with the wind in our hair and whatever else. I like to ride with a helmet on. That's a different philosophy, but they've been very successful. So let's take a look at what happened with this. In abstract number 1, the role of helmets in reducing head injuries from motorcycle accidents, Western Journal of Medicine, 1981. You look at 311 motorcycle accident victims. This was a retrospective review. There was a decrease in deaths from 11.5 per 10,000 to 5 per 10,000 when the federally mandated laws went into place. And then 29 states partially or totally reversed their legislation very quickly. And with partials, what we mean is they limited to certain age groups. You know, you don't have to wear a helmet, but if you're under 18 or in that age group, you're going to have to do that. Claims that helmets increase certain types of injuries have totally been disproved, and that's been one of the issues with the activist groups. Well, actually, helmets are bad for us. We can't see very well, and because the helmet's so heavy, it's going to slam our head into the pavement. You know, when you look at the data on this, none of that is true. It's all been proven not to have any significant impact. Major increases in severe injuries are noted since all the revocations took place. If you look at the details of this study, admissions went from 47% to 59%, mortality almost doubled 4% to 7%, major head injuries from 11 to 31%, and 82% of those with severe head injuries, guess what, weren't wearing a helmet. So it's amazing that we have all the clinical data, all the medical data we need in the research to say this is a good thing, but because the way our Constitution is constructed, we cannot compel this on other people. And I'll give you some good arguments why we should be able to, and that would be the only argument later. But right now, everyone's successful about getting these repealed. So what is the effect of reversing helmet laws we already have on the books? Do things really work? We'll look at abstract number 2. From 1980, it said 1976, the federal mandate was repealed. It was the state's prerogative at that point, and they went away. Laws, 98% used the helmets when they were in place, and when they were repealed, it dropped down to 48%. Registrations for motorcycles decreased by 6% in that time frame, but accidents increased by 12%. So it's kind of interesting, too, that there's some of these abstracts that say even when you don't wear a helmet, you're more likely to have accidents and more likely to have other injuries. So maybe you're just too free on your bike then, I don't know, but you're obviously at greater risk. Mortality increased in abstract number 2 by 303%. Bad things happen. And that's a common theme here. Abstract number 3, 1977 to 80, they amended in North Dakota helmet law to only under age 18. Let's just make it to that age group and see if a partial helmet law will work. Well, helmet use declined from 54 to 27.6%. Use in the injured went from 50.8 to 26.7%, so not surprising there. Head and neck and face, 22% in the helmeted, 77.9% in the unhelmeted riders. So again, confirming what we know about about wearing helmets, about legislation, about wearing helmets, it worked. 81% of critical or fatal injuries were in the unhelmeted riders. Again, if this is a personal choice, I guess that maybe is your choice to be one with the pavement. But, you know, if it becomes an infringement on other people's rights, which we'll talk about, maybe it's not your right to do so. We'll skip through abstracts 4, 5, and 6. They confirm the same data that we know, that when they repealed the laws, people got more severely injured and got injured more often. Now, some people said that maybe this is just due to selection bias because the people who really got injured more were more thrill seekers. When they've looked at that, really it's not. It's all comers who are motorcycle riders who did not wear a helmet. There was not increased risk associated with that other than the lack of helmet use itself. All right, abstract number 7. After repeal of Pennsylvania's law in 2003, they compared use and statistics for injury. Helmet use went from 82 to 58%. And why is that, too? I mean, do you think people really will comply with the law when you tell them they have to wear a helmet? Yeah, they probably will, and this article really tells us that. Part of the reason is, too, you're in an open space. If you don't have a helmet on, the police are going to know that. If you're not wearing your seatbelt, you might slip by, and they may not know that. They have to have probable cause to stop you. Well, if you're not wearing a helmet, you're on a motorcycle, there's your probable cause for breaking that law. All right, hospitalizations increased by 28% for non-head injuries and 78% due to head injuries. So 28% for non-head injuries. So helmets appeared to also reduce the risk of other injury. Why, I don't know, but that's the reality in a couple abstracts here. Deaths went from 25% to 66%. Acute care hospital charges increased by 69%. For non-head injuries, 132% for head injuries. And I'm going to ask you, who's paying for that? Yeah, largely we're going to talk about one abstract that confirmed, I think it was back in the 80s, that we're paying for most of that. And that's where the issue comes to light, where maybe your right to have your civil liberty stops at my checkbook. And when I have to pay for your right, then maybe there's a way to get some of these laws enacted again, because that is a compelling government interest to make sure that you're not asking other people to burden the healthcare system because of a bad choice that's made. Well, look at this too. $53 million. The cost for acute hospital charges went up to $134 million in Pennsylvania because of this change. And post-discharge healthcare facility use was 87% for head injuries. I mean, significant. All right, are there any drawbacks caused by helmet use? Well, I already let the cat out of the bag with this one. No, there are no drawbacks. Others have said that it causes C-spine injuries and we shouldn't have to use helmets. It's not the case. Look at abstract number 8, a regional road trauma registry, over 17,000 injured riders between 96 and 2005, and there was absolutely no association with neck or cervical spinal injuries if you wore a helmet. So when someone says that, no, helmets work for you, helmets don't injure you, but for some reason, if you still want to take the risk, if you have health insurance and you want to cover that on your own, then go ahead and do so. But when we're expected to cover it, maybe it's a different discussion. Look at abstract number 9. Injury patterns and helmet effectiveness among hospitalized motorcyclists after Minnesota repealed their law in 1977. 12.9% involved the C-spine of fractures. 25% were fractures, and 12.9% involved the C-spine in particular. Severe head injuries are 5 times more likely, and no helmet use had 6 times more likely to have a fatal head injury. So again, not a surprise there. You don't wear a helmet and you get head injured, you're more likely to have a fatal head injury. Yeah?
One area of sort of a non-legislative way of enforcement, do insurance companies mandate, they won't cover your injuries if you don't wear a helmet?
That's a great question. He said a way to not legislate this is to maybe if insurance companies had a requirement that, hey, listen, if you're not wearing a helmet, we're going to cover your injuries. Anyone aware of that? I'm not aware of, my policy doesn't state that. It's more based on the years of survival as a motorcyclist. Your rates go down, I think. They figure you're probably doing okay. But I have not heard that. Have any of you heard that? That would be a nice thing to do.
It might not work for the same reason that you stated earlier.
Right. And
The states can't mandate it.
right.
I don't know,
Well, it's not. It wouldn't be a state mandate, so it might be possible. But I think what would happen is, if you look at how this would play out, and I would have concerns about it because if you don't wear your helmet, and some of those people wouldn't, they're thinking they're going to get by with it because they're never planning to have an accident. So the day they don't, the insurance company gets to deny the claim, which is what we don't like them to do. Now, where's the burden? The burden's back on the public again, and the insurance company is out too. So I wouldn't really try and pursue that, but I like the way you're thinking on that, though. Yeah, a couple questions back here. Yeah, if the insurance industry would cooperate, you're right. Change it to a higher deductible or some other disincentive.
Before they had the mandatory ticket laws, my insurance company would waive the deductible if you were wearing a seatbelt in the accident. So that was the way to financially incentivize.
That's nice. So he said in the past, his insurance company waived the deductible if you had your seatbelt on. Well, that's a good way to go. I think since the seatbelt law is in place now, I bet most insurance companies don't have that incentive in place. They probably removed it because the federal government and state governments have taken over for that. But anyway, good way of thinking on that too. But I don't know if there are any solutions right away on this. But do helmet laws really affect helmet use? Yes, we know that. According to NHTSA, in 2007, 97% of motorcyclists wore helmets in states with universal helmet laws. They wore them. They don't like to get ticketed. People don't like to pay money that they wouldn't have to. And again, you're in an open area. You're going to get tagged for this, and you're going to get a ticket. So how good is our science on the issue? The science is great on the issue. It's not equivocal at all. The issue comes down to, does the science and does common sense outweigh your right to freedom and civil liberty in this country? No, it doesn't. So what that says is the Constitution basically says you have the right to make stupid decisions in this country. That's your right. And I guess that's okay to a certain extent. Don't tell me you ride motorcycles because you're scaring me, procedure guy.
Well, that's how I got all the procedures.
There you go.
Military mandates if you have an accident without a helmet on, you assume all costs for your injury.
Really?
It's called a line of duty. It's not line of duty if you violate the requirement that you wear a helmet.
So the military requires this, and so is it while you're in active duty or while you're on your own time?
So a possible solution is to have people have to buy I'm an idiot, no helmet insurance for the right to not wear a helmet. Charge them $1,000 a year for the right to not wear a helmet and put it in a state insurance pool to pay for their long-term care after the brain dead.
Absolutely. So how did you word that then? It was the stupid right to not wear a helmet insurance policy? Is that what you said?
I'm an idiot and I don't want
It's a little long, but it's catchy though. It's catchy. So that would be an option too. But you can see how successful other states and other initiatives have been not very successful. So the data is good. Let's talk about some of this. Abstract number 10, the CDC looked at data from 1979 to 1986. It's mortality data. 53% of almost 30,000 deaths involved head injuries. So if you don't wear a helmet and you have a fatal accident, most likely it's going to be due to a head injury. 17.6, head injury fatalities, when they had a complete law, 11.7 per million was the rate of fatality. 19.5 per million for partial laws and 17.6 with no helmet law. What that tells us is that partial laws are not effective either. You either have a helmet law or you don't. Partial laws don't help. Increased by 184% mortality in South Carolina when they went from a full to a partial, and a decrease in Louisiana by 44% when they went from a partial law to a full law. So again, confirms that partial laws are not effective. You need a full law, and having a law in place really does work. Abstract 11, again confirms that helmet use does not predispose to C-spine injury. And abstract number 12 basically reanalyzed abstract number 10, all that data from the CDC. There were criticisms, and people said, you know what, you didn't control for different states, different riding habits, different rider styles, all kinds of different things. Make a long story short, they recycled the data and came up with the same results. Not a surprise. The mortality is really bad when you don't have a law in place and you don't wear helmets. So what are the economics of the motorcycle helmet issue? Well, we've kind of touched on them. But the economics are staggering. Let's talk about that. And one of the first people to document some information is Norman McSwain, trauma surgeon at Tulane. Does anyone know him? Anyone meet him? I trained with him, and the guy was pretty phenomenal. The only guy that I ever saw that would come to a trauma resuscitation in snakeskin cowboy boots. I haven't seen anybody since, but pretty impressive guy. But in the Journal of Trauma in 1984, he basically said medical costs for unhelmeted riders were 2 times. It was greater than 200%. So we know, even back then, that we were going to have significant costs associated with this. Abstract 14, motorcycle helmets, medical costs, and the law. McSwain again, Journal of Trauma, October 1990. The only downside of this article is that it was stated that it really did not give the full due to the significant cost associated with this. So re-looked at the data and published it in the New England Journal later that year, and the data was even worse. There are substantial costs associated with this. And again, the question is, if you want to bear the burden of your own responsibility for your own costs, you can make dangerous decisions. But when the rest of us have to bear the burden of your bad decisions, that's not fair. Abstract 15, 105 patients. And this is back in 1988, so kind of extrapolate that to current costs now. 105 patients only, head injuries in 57% of them. The direct cost of 20 months' worth of care was $25,764 per patient. Total for those patients was $2.7 million. Public funds. So how much had to be covered for public by the public? 63.4% of the direct costs you and I paid for those 105 patients. Indirect costs, loss of productivity, not participating, in the community, not working, was estimated at $850,000 to a total loss of the community of $7.1 million for only 105 patients back in 1988. So what do we think those numbers are now? We don't know, but they're certainly higher than they were back then. And we also know that we're paying the majority of this, over 60%. Abstract 16 looked at motorcycle helmet use, injury outcome, and hospitalization costs. And basically they just showed average hospitalization was over 16,000 unhelmeted and 12,000, basically 12.5 for those who did wear a helmet. So even if this is a little bit softer than some of the other abstracts, but even so, if you just look at helmet use alone, they were significantly more expensive. All right, number 17, I love the title of this abstract, Putting a Lid on Injury Costs. Put a helmet on, you reduce the cost. I like it. They looked at California, the motorcycle helmet law, and hospitalization rates fell 25% when helmet laws came into effect. Total hospitalization and rehab costs fell, nursing home costs fell, and mortality rates fell by 33%. And costs for publicly funded patients decreased by 30% after implementation of the helmet law. 30%. Total costs decreased by 35%, which equated to $35 million. So is it fair that we burden the public with a substantial portion of $35 million? I don't think it is. And our last abstract, 18, kind of a colorful one, the influence of ethanol intoxication on outcome of injured motorcyclists. Do you want to drink alcohol when you're riding a motorcycle? This is what we're getting to without a helmet. I mean, that's a pretty scary concept. Basically what it does, it nullifies the helmet. So if you are going to drink and you throw the helmet on, it's like not wearing a helmet. And those who drink and don't wear a helmet, it just magnifies it substantially. So intoxication, mortality and critical head injuries, 43% versus 80% in those intoxicated. So substantial risk if you're drinking and riding a motorcycle. And then if you're drinking without a helmet, it's even substantially greater. But maybe that's Darwin at work for us there. All right. Any questions on motorcycle helmet use? Yeah.